So tuberculosis is one of the very infectious problem that is common. A lot of people have that problem, and therefore it's very common to be tested. It's caused by a bacteria called Mycobacterium. So the name of the bacteria is Mycobacterium tuberculosis. So and it's a bacteria, and usually it's transmitted by airborne. Somebody cough, and then you get infected with that. There is two forms of infection. There is a latent form and the active form. The latent form just means that you tested positive for PPD. Okay, tuberculosis, basically you tested positive for without any symptoms. So without any symptoms. And the active TB is when you have active symptoms. You tested positive for PPD, and then you have symptoms in addition. So there is a distinguishing that you have to know in terms of what is a latent TB and active TB. So when somebody get infected, you get into the system, your body fight against the infection, and you store these bacteria mostly in your lung as granulomas in your lungs, and they become latent and become dormant. That's what it means. When you get older or you become immunocompromised, like you have HIV or basically you take any medication in lower your immune system, and they can activate this latent TB to become active TB. So that's all what it means. The two difference. Well, you have to know how they present and how they test it. Okay, latent TB, they have no symptoms. And usually we test it using a TB testing. So TB testing. And that's you've seen it before, the Matos test. So in your exams, when you see TST, it means tubercle skin test. And what they use is they take the purified form of the protein of the bacteria. So the PPD means purified, they've purified it. Okay, protein derivative. So that's what it means, PPD, of the bacteria that causes the TB. So they inject it under your skin transdermally, and they use 0.1 ml of that and inject it. You have to know, in fundamentals, you have to know how much you inject, and then the angle is like 15 degrees. So it shouldn't be more than 15 degrees because it's going in transdermal. So it's a transdermal injection. And then you come in, and then you go back 48 to 72 hours for it to be read. It becomes positive if there's induration. So be careful. They can trick you and they put erythema. Induration means it's positive. And you're looking for maybe like 15 millimeters induration. So this is how the PPD is done. And you're looking for 15 millimeter induration. Erythema is not. You expect to have some small erythema, but induration, you're looking for like bump about 15 millimeters, which is 1.5 centimeters, basically. Okay, so that's what they do for and if this is positive, and without symptoms, no symptoms, that's latent TB. That means you have latent TB. They usually get a chest X-ray to make sure that there's no active infection in your chest X-ray, and then you'll be considered latent TB. They can ask you questions. This is a testable question. So these patients, they are not infectious. Otherwise, we will be in isolation. Just having a latent TB, just testing PPD positive, you are not infectious. Okay, so these patients are not infectious, and they are not contagious either. Okay, so you don't need to isolate them. They just have the bacteria in them, but the bacteria is latent. So that's what it means. Active TB means you have tested positive and you have symptoms. And what are the symptoms? The symptoms are common. We call it, the way I remember is B, TB. So B symptoms. B symptoms is the name they use it for, like a lymphoma, leukemia. So you can use both information, try to remember it. So this is all pathophysiology. So they have B symptoms. The B symptoms, you see active TB. So there's TB, tuberculosis B. B symptoms, they have like night sweat. So and they have weight lost. Those are all B symptoms. Okay, and they will have anorexia. Okay, and they get fatigue. This is common for patients who have like lymphoma, leukemia. They develop these base symptoms. But for tuberculosis, they can have cough. So they may have cough, and there may be some blood thing. There may be some blood in it, a little bit of blood. So this is active. But B symptoms with the cough. So night sweats, that's how you can remember. If you know what B symptoms are, night sweats, weight loss, anorexia, and fatigue, common to lymphoma, and you can remember that. And then you add cough to it, that is active TB. How do we diagnose active TB? Well, they need a sputum test. They need a sputum test. So it's a sputum test. You have to cough it out, okay? And they have to test it, and they have to do a culture and a smear of the sputum. And usually the test, they look for positive acid fast test. So acid fast. So AF, or I'll write everything, acid fast test. And that will show that you have active TB, okay? It is very important to understand that the sputum, the time you collect the sputum is very important. So early in the morning, AM, let them wake up early in the morning, let them goggle their mouth and take all the bacteria off. You can't just wake up and then you take the sputum from their mouth. They may have bacteria in their mouth already. You don't want it to be contaminated. So let them wash their mouth. It's okay. So wash mouth, and then let them give you a clean sputum. And you need 3 of them, okay? 3 sputum to confirm. So this confirmed diagnosis. So the confirmation of TB for active TB is 3 morning. It's morning sputum, no afternoon, no evening. Morning sputum. But make sure you let them wash their mouth before you get it. Okay, so that is the confirmation of the test, and this takes some time for you to get the results. So, but these patients, as soon as you anybody suspect of having active TB, isolation. So you isolate them right away before you get the results back. So that's it. So we talk about the side effect, this thing, the what usually involved with TB and other things. So we'll talk about it. The other thing I want to say before I talk about transmission, I said something about the TB, the tuberculosis test. Sorry, this thing. So we did a tuberculosis skin test. There's another test, okay, that you can do. If you see it on your test, is quantiferon. That's another, if you've heard it before, quantiferon test. This is another diagnostic. I mean, it's a screening. They are all screening tests. The TB test, this is the screening. The sputum is for confirmation. So confirmation. So another screening. If you don't do the skin test, you can do quantiferon. There's few things you have to know with quantiferon. This is a blood test, so it's not a skin test anymore. And usually it's very expensive because it's a blood test. That's why we don't do it that much. But if you see in your test, you just need to know a little bit about it. It's a blood test, and then they draw your blood, they send it to the lab, and they do it. It's a very quick turnaround, 48 hours. Therefore, you don't need to come back. So you don't need to come back. Come back for the results. No, the doctor can call you. You don't have to. They have to read it again. They draw the test and they do it. So it's a single visit. So this is a single. So if it's inconvenient, the doctor will do it. But there's just to let you know, there's something called quantiferon test. It's not the same as tuberculosis skin test. And this is usually blood test. It's expensive. It's a one-day problem. You don't have to come back and do it again. Now, transmission. Okay, this is infectious control. This is airborne. So there's three types. It's a contact, airborne, and droplets. So this is airborne. In your exams, you try to make it easy in your brain, and so that you can stay focused. When we say transmission precaution, anybody that come to the hospital need a standard precaution. Standard precaution means you wear gloves, you wear gown, and you wear masks and everything. Everybody needs standard. You want to prevent infection as much as possible. But when they said that standard precaution, everybody, you got to make sure you maintain hygiene, you're washing your hands if you have to touch something. So those are all standard. If you need to wear gloves to give injection, yeah, you get to do standard precaution. But when they specifically ask you for transmission precaution, they have grouped these diseases that can be transmitted from one place to another specifically. That's what they're asking. So for airborne, basically, the reason why is an airborne is the particle, when you cough it, can stay in the air for a long time, more than 3 feet. So it can stay, it's not droplet. So it can stay in the air for a long time. And so and it's very small, it can penetrate certain marks. So it takes a long time for it to get out of the system. It's airborne, like Superman. Superman can stay all the way in the air for a long time. And therefore, these organisms, you need to have specific things to do. So when they ask you transmission precaution, just you group them into a certain way. So transmission precaution, every transmission precaution for organism that is airborne need a special mask. So they need the N95. N95 means you wear a mask, certain masks that will prevent passage of the bacteria 95% of the time. So at least 5% passes by 95%. The 95 is who is wearing it. That's where they trick you at. It's you, the nurse, you protecting yourself. Wearing N95 doesn't protect the patient. The transmission precaution is talking about you taking the infection from the patient and sending it somewhere. So you have to wear the N95 mask, okay? Then the patient has to be placed in the pressured negative pressure room. So pressured negative room. And they have to be alone so that they don't give it to another patient. So it's private. You see what I've done? I just made it the way it's supposed to be. You're just thinking about it. So N95 to protect the nurse. They need to stay in the negative pressure room so that it can suck the bacteria out of the hospital so that it doesn't spread. It suck it out and it go outside the hospital instead of staying in. And the patient has to be alone in a private room. But then this is I want you to pay attention. If they're going for any diagnostic test, Diagnostic test is like they're going to get like X-ray or CT scan, any diagnostic test. Now the patient, okay, patient, because he's leaving the negative room, patient has to have just a surgical mask. He doesn't need N95. He wears surgical mask. You, the nurse, still wear N95. And you have to notify the place that is going so they too will wear N95. This is all you need to know for any airborne disease. N95 for the nurse, patient in a negative pressure room, they are in the private room, and the door need to be closed. Door completely closed. Door is closed. They are in the pressure room, in private room, door closed. If you're going for diagnostic test, they have to wear surgical masks, and you, the nurse, continue to wear N95 and notify them. One last thing, if in their room, okay, if this is the patient room, okay, there is a back door. So because their regular door is closed, this is the door that go into the come into the maybe the hallway where the nurses are sitting. This door will be completely closed. So there will be a back door and patient will be here like that. So this back door go to another room. Okay. So you don't go through this. So this door is closed. This door is completely closed. So you go through here and you wear your mask. You wear your N95. So most of the N95 is all here. You wear here, then you go to this. There will be another door here, and you pass here, and you go to then see the patient. And then when you finish, you go the same way. You come here, stay here, and take your mask off, and then come out of this room. This door remain closed. So you can go here to this room and observe the patient. So there have to be a break room or a side room, okay, that you can observe the patient, or a second room where you can go without even entering the patient room and observe them if something is happening. If you need to go in, you just wear your mask there and you enter. But the main door is completely closed. So that's the transmission precaution for that. Because that's all that you need to know for that. And they can trick you. Okay, they can trick you and they will write it, but you just have to stay N95, okay, for the next surgical mask if you're going for diagnostic tests and all the things that I've said. That's all you need to know. Now, this is the key, the pharmacology. I think the pharmacology is interesting. I made it easy for you. TB is airborne. It goes up, it rises. So TB rises, okay? That's airborne. Airborne rises. So that's how you got to remember the medications. There's 4 medications. TB rises. So that's the acronym. TB rises. Therefore, the R is Rifampin. The I is Isoniazid, and the S is Streptomycin, and E is Ethambutol. So that's how you can remember them. Then we talk about their specific side effects. But to know which medication are TB medication, TB rise, which is Rifampin, Isoniazid, Streptomycin, and Ethambutol. You can see one problem has 4 medication. That means it is serious. It's difficult to treat. The first one we'll talk about is isoniazid. So it's called isoniazid. And as you can see, it's isoniazid. So isoniazid. Usually this is used for prophylaxis. So PPX. That's my writing prophylaxis. That's the simple way to write it. And it's given as a monotherapy. I will explain it to you. So it's usually given as a prophylaxis and monotherapy. That means if you have latent TB, okay, you tested positive for TB, to be treated, we use isoniazid, INH. So you can use INH alone, and usually you need it for like 6 to 9 months. So it's a long duration. So that's what is used for prophylaxis. What they're going to ask you, so this can be used as a monotherapy alone for latent TB. What they're going to ask you is the side effect. Okay, that's what the question is going to be. Side effect of the medication. Okay, and the number one side effect, which is expected. So number one, but is expected, is peripheral neuropathy. So they will have tingliness and numbness of the extremities. So they have like something like paresthesia. So, and sometimes they can have ataxia. But in your exams, they will write this peripheral neuropathy or tingliness and numbness of the hand. This is an expected finding of isoniazid. Because of that, so I'll put education here. Oh, let me just put it. Because of this, I'll just go down using my pathophysiology technique. Because of this, we want to prevent the paresthesia, peripheral neuropathy. So you give them this medication, vitamin. So they just, all they need to take is vitamins B6. And it's very common medication. So paroxetine, vitamin B6. So all of them, anybody taking isoniazid needed B6. This is a must. If you give them B6, it will decrease the incidence of peripheral neuropathy. You have to know, in case they ask you, there's some patients, their risk of peripheral neuropathy is high. And these are patients who is slightly immunocompromised. So HIV patient, pregnant ladies, they are immunocompromised. Diabetes, you know, the immune system is a little bit lower than normal, and older patients. So older patient. These four people, their risk of peripheral neuropathy is very high. So you need to give them everybody, but you got to be especially careful with this patient. Give them basics. And then the dose is like 25 to 50 milligram per day. So they take it with that medication for 9 months. Okay. Then after that, that's the most common side effect. One thing everybody forget is there's one more thing you should avoid: aluminum antacid. Antacid will decrease the absorption of the isoniazid, and usually aluminum antacid like Maalox. That will is going to, you know, all antacid will coat the bowel, the stomach, so that they will prevent absorption of uh, um, medication. So one of the clues, whenever antacid in your exams, is always bad, especially if somebody is going to take medication. Is either you take your medication and wait 2 hours and take the antacid, or you take the antacid and wait for like 2 hours later and take your medication. But the best way is to take your medication, wait for 1 to 2 hours, then take the antacid. That's the best order. Now, this is something you have to be careful. Sometimes most people forget. All the TB medication affect the liver. Okay, they have toxicity. So all the liver TB medication is going to affect their liver. All the four of them. So you got to check their LFTs. What that means is LFTs is AST, you got to check it. ALT, you got to check it. And then bilirubin. This is, and if it's affecting the liver, that means they have liver infection. So hepatitis, so liver injury, okay, injury of the liver, all of them. Therefore, you can teach them precaution. You see what you can use. You can use this. This is one thing is going to affect the liver. So precaution. Well, avoid alcohol. You know, alcohol causes injury to the liver. So they shouldn't drink alcohol. If they drink alcohol, which causes injury to the liver, and now they're taking medication that is affecting the liver, that is bad. They should avoid medication that affects the liver. Also, all medication that affect the liver, you have to be careful. And what do you think? The common one, you go to Walmart and go get it? Well, Tylenol. You should avoid Tylenol. So they should, if they have pain, they shouldn't take Tylenol because then Tylenol will it will cause liver injury and it will make their liver injury worse. Right? So those are the things you should tell them to avoid, because those are the things you. Then if I'm an examiner, well, I will tell you somebody is taking isoniazid and he has a liver injury. What do you expect? Or somebody is taking an isoniazid, and I will give you some sort of question. Basically, it's the side effect because it caused liver injury already, liver injury. So what do you think in liver injury? When patients have liver injury, you can look at my cirrhosis video. Well, they become yellow. So jaundice. So yellow in their skin, in their eyes, characteristic. If it's a African American black, look under their tongue. That's where you see jaundice. And then what do you think? And it became jaundice. They are jaundice everywhere. So their urine will become jaundice. So sometimes we call it T-colored. Be careful. I use the word T-colored because one of the TB medication changes your urine color, but this is T-colored. T-colored means urine is from the bilirubin. Then their stool color will change. It will be clay-colored. Okay, clay-colored urine is because of bilirubin. And that's what you have to know. And then if you have liver injury, high level of bilirubin will make you itchy. We call it pruritus. And your education is what? Make sure you cut their fingernails flat, or you let them wear gloves so that they don't scratch their skin all the time. So pruritus is bad. They hate it. They'll be scratching their skin. And then they will have anorexia. They don't want to eat. And they become fatigued. These 6 things I've written here, if you know it, any question they ask you on the liver is the same. It doesn't change. Somebody have cirrhosis of the liver. This is what is going to happen. Somebody have hepatitis A, B, C. It's the same things. Any injury to the liver, it become jaundice, urine become clay-colored, become T-colored, stool become clay-colored. They have pruritus, and therefore you cut their fingernail, let them wear gloves. They have anorexia, they become fatigued, and if they want to still make you think, they will give you lab work. And what do you expect? AST and ALT is elevated. They will give you bilirubin, which is elevated, and the liver is responsible for making all protein. If it's injured, protein albumin is down, liver make all clotting factors in your body, and therefore the clotting factors, you can't make clotting factors, therefore your PTT goes up. Your PT goes up and your INR also goes up. You see what I'm doing? And so that's what is happening. You having this going on, and they can ask you all these questions. So PT go up, INR go up, albumin go down, bilirubin go down, AST, ALT go up. And then I can add one more. Ammonia is going to go up because that's what the liver is going to metabolize. So I'm putting cirrhosis and everything. You can connect it. This is what you do. You got to put everything together so it makes sense in your head. Don't separate and topics from each other because science is interconnected. So all TB medication can do this. So I started from here and I went all the way back to fundamentals and pathophysiology and GI. So you can connect it. So that is, we've taught them, we provided teaching, don't take Tylenol, avoid alcohol, don't take any medication that affects your liver. This is what you expect in them. And so if they're taking medication, you can cancel them. But peripheral neuropathy is expected. Liver injury is your priority finding for patient who is taking this. If they have peripheral neuropathy, well, I give them vitamin B6. I'm worried more about the liver injury. The second medication also is very important. But this is used, it can also be used, usually they don't use it as monotherapy. So they combine it with other medications. So it's used likely when you have like active TB, basically. And remember, when you have active TB, you need four medication for 6 to 9 months. So, but if you have latent, you have only one medication. So that's four medication active TB. So Rifampin is used for combination with the other ones. All the TB medication, the rise, each one of them have specific side effect. Rifampin side effect is red, orange secretion. That is classic. You see, Isoniazid, yeah, we talk about peripheral neuropathy. Rifampin is red, orange secretion. So wherever it makes secretion, is going to turn into red, orange. So when they cry, so their eyes, tears will be red, orange. When the saliva will be red, orange. When they pee, so their urine will be red, orange. So you teach them education, okay? When you cry and you have red, orange, don't freak out. It's normal. It's unexpected. Don't be sharp about it. It be expected. So you tell them if they wear contact lens, just change it to regular glasses for now until you finish for the 6 to 9 months. Until you finish, then when you finish, you can wear back your contact. Otherwise, your contact will stain. If they have dentures, well, it's also going to stain. So they shouldn't freak out or worry if or disturbed or be so mad about it that their dentures is changing color or is infected. No, it's just the red orange secretion that is causing that. When they go and pee and they see red orange, don't call the doctor. That's okay. That's an expected finding. So that's the teaching you provide them. So that is the specific side effect for rifampin. But then one more teaching you got to let them know. Rifampin will decrease birth control, okay, function. Or effectiveness. Okay, so effectiveness of birth control goes down. So what do you think? If we're taking birth control and it's not effective, well, you'll get pregnant if you don't want to. Yeah, you're taking birth control because you don't want want to get pregnant. Well, if you take Rifampin, it will make it ineffective. So they should add another one. Usually, they should add condom. Okay, condom is the best one. If this is you can't add another birth control because you make it ineffective again. So use other form of contraception, which is a condom. I think will be best. Or the woman will wear diaphragm. Whatever you, I'll just make it easy. Barrier method. So whatever barrier method you want, or they will put in your answer choice, just pick that one. In addition to the birth control that they're taking. Okay, so you should let them know that this is unexpected. And as we already said, all TB medication do what? Affect the liver. So I'm not going to repeat the same thing, but you tell them to not to take any medication that will affect the liver, not to drink. Those are the two things. If they also cause liver injury, so you know what to expect in liver injury, what lab work you expect in liver injury, what physical finding you expect. So don't be surprised if they give you pharmacology and they're asking you cirrhosis question. Somebody is taking Rifampin for TB. Which of these lab work you see? Well, it's liver injury. So you see the liver injury lab work or symptoms with the liver injury, in addition to an expected finding, which is red-orange secretion. So the red-orange secretion is not, is just expected. Liver injury is you being sharp about it. So you're looking, so priority finding is liver injury, being sharp about it. The second one, so we go, the third one is Ethambutol. This one too is a TB medication, is used in combination. So this is combination for active TB. If you have active TB, that's what they're going to give it to you. That one too has specific side effects. And then the easy way to remember that one is the E. It's okay. Is the E there is for your eyes. So it causes optic neuritis. So inflammation of the eye. So the nerves is infected. It's inflamed, no infected. So optic neuritis or ocular neuritis. But that's the eye. So the E means for eyes. E for eyes. This they need to see ophthalmology. So you have to let them see ophthalmology during therapy. So maybe for the 6 months, they'll see them like 2 or 3 times to make sure it's not getting worse. Or to look for it. So the side effect is not that you taking it, you get it, but to watch for it so that when you develop it, it can be taken care of. Okay. And of course, liver injury. Therefore, no alcohol, no meds that affect your liver. And the same teaching you're going to give them, the same finding you expected. So this is not a B sharp, but this is an expected, but you have to know about it. You have to go to ophthalmology. You worry about it. This one is serious. You worry about it. Okay, ophthalmology, they will lose their eyes, but you also have to worry about liver injury. There's nothing you have to do about it. That's why you set them out for ophthalmology so that it can prevent it. So those are the two. That's what you need to know for that. So E for Ethambutol. And then the S, I think this one is straightforward. The S here, you know what it is, and the myosin. So just by the myosin, forget about the S. Myosin, I know you've heard it before. Myosins are antibiotic. They're all antibiotic. And what kind of antibiotic is? This is amino. Look at what I'm going to do. Aminoglycoside. Aminoglycoside. They have the last name myosin. Streptomycin is an antibiotic. Guess what? aminoglycoside. There's two side effects that you have to know for your test. If they give you any mycin, it's your urine or toxicity. And the second one is what? Nephrotoxicity. So it affects your eyes, no, your ear, hearing, and your kidney. So you got to watch for that. That's the main side effect for this medication, their hearing and their kidney. So ototoxicity and nephrotoxicity. Just by knowing that it's an antibiotic, what kind of antibiotic is aminoglycoside, then I can deduce that it's going to cause the hearing. So they may have tendinitis, that's the early sign, or the kidney problem. Okay, so if the kidney problem, well, their creatinine will go up, their BUN will go up, and this is something you should just know. It just come like that. You don't have to memorize. Streptomycin is an aminoglycoside. Most aminoglycoside have autotoxicity and nephrotoxicity. So you have those two side effects. And of course, don't forget, all TB medication causes liver injury. So hepatic inflammation, so hepatotoxicity. And then you know the side effects or the symptoms you should expect for that. And that is briefly all the TB medication, and that's how you can remember it. Remember, TB medication is rise because TB airborne, so airborne rises. Rifampin, Isoniazid, Streptomycin, and Ethambutol. Streptomycin is an antibiotic, which is an aminoglycoside. Therefore, you can get it easily. You know the side effect. Ethambutol, because of the E, is a high problem. They see ophthalmology. And briefly, that's all for that. So I have one quick question for you. I combine everything. SATA question, read the last one. Which of the following is consistent with the diagnosis? So this is plus, consistent. A client was admitted with active TB. So he has active TB. So what do I expect when a patient who has active TB? Negative pressure room. Yes, they have to be in a negative pressure room. Night sweats. Yeah, these are symptoms of active TB. Surgical mask. Who wears surgical mask? Well, they don't specify, so you can't say anything, but I'm thinking this is the N95 for the nurse. So this is wrong. A 3 negative sputum test for clearance. Yes, you need 3 sputum for diagnosis. Then before you can say they don't have active TB, you still need 3 sputum tests to say everything is negative. Remember, sputum is taken in the AM sputum, not night sputum, and they have to wash their mouth. Dedicated disposable equipment. No, this is for contact precaution, like MRSA. Client wears surgical mask for a trip to X-ray department. Yes. Vitamin B1, while on isoniazid, they need vitamin what? B6. B1 is thiamine. Okay. So wrong. Weight loss. Yes, somebody with active TB, those are the symptoms. Tylenol for pain. You know they're going to give them 4 medication, which affect the liver all the time. So this is a knowledge application. You got to apply. 4 medication that is going to affect the liver, where they shouldn't take anything that will affect the liver. So Tylenol is wrong. Ophthalmology appointment with Ethambutol. Yeah, E means eyes. So we needing to go see ophthalmology. So that's right. So this is the end of it. Thank you for listening. And then if you like it, subscribe to our website at YouTube, Adapt NCLEX, and then put some comments. And good luck in your exams and keep charging.